Hi, I'd like to talk to you about the mobile pain program, the relative mobile pain program. We use what is called neurofunctional pain management. And this is a very established and proven treatment for pain, for chronic pain patients. The technology we're using for this has been FDA cleared and approved for pain treatment for over 30 years. There are a number of reasons why you don't see it in the market very often, but I can explain some of that as we go. But I wanted to take a few minutes to explain what the treatment is and then how the mobile nurse program works for all the nurses who are interested in joining our program and becoming a mobile pain treatment nurse. So, quickly, I will go over just the treatment aspect of this and how it works to treat patients. I'll cover some of the details behind it and why it works and all those things, and then how the mobile pain how the mobile treatment aspect works for nurses. Okay. So the neurofunctional pain management is a three-part program. It uses electroanalgesic therapy combined with an IV hydration therapy and also a health coaching program. So in this model, we are delivering a high pulse current therapy that actually relieves pain. There's a number of things that this does. I don't want to go into the details here. We can talk about it later, and I have other videos and I have other publications that talk about this. But the electrical therapy alone is very successful at treating pain, even by itself. And there's hundreds of studies on technology similar to this in various capacities at treating pain. But to the bottom line is that what we have is called electroanalgesic therapy as the device. We use what's called a Neuromed PMT mobile system, and that is the device we use across the country for this. And it produces high pulse therapy. Now, the big difference, a lot of you out there probably are familiar with TENS units, which are low pulse therapy. So the pulsation matters. The FDA classifies these devices very differently. TENS units are muscle stimulators. EA systems, electroanalgesic, we call EA. EA systems are neural stimulator systems. And the FDA has separate classifications for that. If your device goes into the high pulse ranges, you're in a neural stimulator, right? If you're staying in the low pulse ranges, you're a muscle stimulator. And that's how they keep those two things different. It's very easy to get a TENS unit into the market, right? Yeah, there's hundreds of them, and you can buy really inexpensive ones on Amazon for TENS units because those are low power devices that stimulate muscles, and it's very easy to get those. A neural stimulator has high pulse technology that actually stimulates the neurons to depolarize the pain neurons so they don't report the pain. The technology in these devices is actually very similar to what is now spinal cord stimulator implants, right? So the high-end neuromodulation market that you hear about and see, that all of those high-end devices that are implantable, those all derived from this type of original technology. But nowadays, most companies don't want to make an external device. They just want to make a very expensive implant, right? And that's why you don't see a whole lot of this being offered in doctors' offices. Instead, they're just trying to get the patients to, that are eligible for it to go and do, implants and surgeries. And that's really what you see in the pain and interventional pain market for that. So that's one component. The EA therapy works amazingly well. I just put out a publication a couple months ago showing that we're over 90% successful at treating neuropathy, peripheral neuropathy. So it's a very successful treatment model. So, but our treatment model is called neurofunctional pain management because there's multiple things that are happening. EA is the first one. The IV hydration, very simple IV hydration model. It's just vitamin mineral IV with a glutathione push. It is not complicated. It's very easy. The experience we've had with this since 2018, when we started doing this in 2018, we added IV along the way because we found through just, I guess you want to call it trial and error. We had patients doing IVs with us at the same time, and over time, talking to other doctors and our program experience, we determined that just including the IVs with the therapy was added an enhanced effect of the pain relief. So we saw patients, they got better faster. They had a stronger pain relief effect, and it would last longer after they complete the treatment. The results would last longer. So all those things are occurring when you combine the IV and the electrical therapy together. And then the last one's health coaching. You'd be surprised. Most patients are not terribly excited about health coaching. If you just were to go up to a patient in chronic pain and say, hey, let's talk about your eating habits and your exercise. And they're sitting there in chronic pain, right? They're not very interested in talking about that. But once they get out of pain with our program, they become very interested, usually become very interested in talking about their health habits because we tell them if you will make some health changes along the way, by the time you're completed with the program, you could be out of pain in a better state of health and you can help it last longer. You can actually keep the pain relief effect occurring for a longer period of time after the treatment is completed. And patients will start to listen to that, right? Oh, okay, well that's interesting. And the evidence for that is that they're already getting out of pain. So that's the priority number one, is get them out of pain. Priority number two, let's get them healthy again. And then priority number three, they enjoy their life again. And that's the you'll see I have that listed everywhere. Our mission statement is relieve pain, restore health, and magnify quality of life. You see that everywhere. I actually created that catchphrase or that mission statement back 5, 6 years ago. I have since seen multiple other companies pick up and use that because we obviously we didn't hide that in our marketing. So a lot of people thought that sounded great. You see it everywhere now. But relieve pain, restore health, magnify quality of life. I even have the piece of note paper that I wrote it on originally back in like 2018, 19. So that being said, that's what we're doing here with that. Those three components of the program, that's neurofunctional pain management. Again, extremely effective, over 90% successful with multiple kinds of pain. But there's about 24 different types of pain we can treat. Everything from traditional or common peripheral neuropathy, which are so many patients with that problem, to specialized types of pains. There's a bunch of different kind of rare pain issues that we can treat. TMJ or trigeminal neuralgia, which are very complicated to treat, but they're, facial pains, things like that. And there's also just all sorts of other types of, musculoskeletal pains all over the body, and we can treat all those very effectively. So that's what we're looking at. Pretty much any type of musculoskeletal pain condition we can treat, and we can do this in our program. So, okay, that is how the program works. Now, the actual treatment cycle, patients are treated twice a week for 8 weeks. So there's a total of 16 treatment events that occurs. And each week, the patient is receiving two treatments. One of those treatments is a regular electrical therapy with health coaching. And the other treatment is electrical therapy IV, hydration, and health coaching. So there's two different things occurring each week, but they repeat every single week for 8 weeks, right? There is a accumulation effect that occurs with treatment. So you have if the patient were to achieve some pain relief in the first treatment, then by the time they have the second treatment, it's starting to compound. The efficacy that occurred from the first treatment is still lingering, if you will, and then the second treatment comes again, and that same kind of buildup of success occurs over time. And by the end of the 8 week program, they will have achieved pretty much as good as they're going to get in this first round of treatment at the end of 8 weeks, right? So most patients get out of pain. Most patients, we'll tell people if the objective is to get a greater than 50% reduction of pain, we can show in all of our research and data that that's somewhere 85 to 90% likely for most patients going through the program. And there's other kinds of pain issues that are very difficult, hard to treat, and maybe our success rates are a little bit lower than 90%. But I would match what we do up against anything that the other options are. Medications, procedures, and surgeries. Sure, I would put our program up against any of those. Obviously, in some cases, the patients need those other things. The surgery is probably something that they might need, right? We're not here to interfere with things that the patient already does need. We're just trying to offer them an option before they have to go down that path, right? That's what we're hoping for. Or if they want to get off medications or don't want to get on medications, right? We can offer our program for them. So look, I had a lot of people ask this question. Why haven't I seen this before? Well, the very, very quick answer, because I could talk about this for hours. One, pain management doctors aren't really equipped to do this program in their office. You'll see this. I actually found this equipment by working with pain doctors around the country and asking what some of these devices would do. And I found out for the most part, most of the doctors that did have one of these EA devices in their office, they said they would save it for last. Like we would use that as a last resort. And I was like, well, what do you mean last resort? Well, if the medications wear off and we have to go to interventional procedures, and if the interventional procedures wear off, and then we can't do any more steroid injections and things like that, we run out the max on that, well, then we could put them on this electrical therapy thing and it will work great. I'm like, okay, well, then my question was, why don't you do that first? And that's a great question. And I asked that question to myself and to them, and the answer is They just don't make enough money for it, right? For the amount of time that and time and effort that it takes to do our treatment program, because each treatment event is an hour long, right? They adopt a interventional pain doctor can do 2 or 3 spinal injections in their, if they have a makeshift, injection suite in their office, or if they are doing, a surgery center, they can funnel all their patients to there and do all the injections all in a row, right? And make really good money for the time they spend. And that's how they pay their bills. That's how they make their money. That's their priority of activities, is doing procedures. I get it. Everybody knows that, but that's why you don't see this in those offices, because this is not the priority. That other stuff is their priority, which is fine. Most pain doctors are getting patients after they've been in pain for years or decades, and they're trying to offer them something immediate, like that steroid injection might actually work really well for right now, right? So there's definitely reasons for all those things. But most patients would much rather do what we have before they do all of that. And they're not being offered that with pain doctors. You see this all over the country. They're not being offered this treatment program. So then the other question is, why don't primary care doctors do it? Because what we do is primary care eligible. I mean, it can be done at the primary care level. It doesn't have to be in a specialist office, right? And the answer is that they just do not have time for this, right? They just don't have time. They're cycling through patients, every 10, 15 minutes all day long. So they don't have time or the space to fit out rooms and do this treatment. That's not what they do, right? And the other thing that, I've had a lot of nurses ask about this, like, how did you get into this being a mobile program? Well, over the years, we've noticed that probably one of the number one reasons why patients couldn't do the program was because of travel, right? So getting to the office twice a week for 8 weeks was just it's not easy for a lot of patients. For a lot of patients, you can't, it's impossible. I can't do it at all. And it was really hard to hear all these patients that desperately wanted the treatment program and couldn't do it because they couldn't get into the office. They didn't have the transportation, or it's too far away, or one of these other things. So I kept thinking for years, this needs to be a mobile program. People need to go out to their house. I had a lot of pushback from all of the quote unquote, expert, medical and healthcare professionals in the world, telling me that's an extremely complicated model with, nurses traveling around and patients living everywhere. I'm like, I get it. It's just a matter of figuring out how to make it work. And that's what we did. So we ultimately converted everything to mobile a couple of years ago, and here we are making it work. Right, patients are getting better, and the nurses are now involved in doing this. And this is what we're talking about when you see the posts we have for this on social media, on Google and everywhere else you're looking and find our mobile pain program. That's what we're doing. It's nurses going out to the patient's home and treating them there. Right. Okay. So that being said, I've had a lot of questions. I can talk about the actual treatment for hours and hours, but needless to say, it works amazingly well. It is covered by Medicare and commercial insurance. Okay. So it's covered, which means that the conversation with patients on this can be a little bit easier. It's not going to be a out-of-pocket cash procedure. Okay. So that being said, let's get into the nurse business side of it. Right. So this is a 1099 contractor position, right? So nurses are effectively operating their own small business doing this. So, and all 1099 contractors are independent, independent employed, people who work for themselves. Our company contracts with you to perform services, and then we pay you per the agreement, and that's how it works. Then you effectively own your own business at that point, and if you want to treat it like that, you absolutely can. And some nurses really do well at that mentality. They're thinking, this is my own business, this is my own thing, I'm doing this, right? And they can do great. Other people have come from bedside nursing, and they're used to just having work assigned to them, right? This is not what that is, right? You don't just get assigned a patient to go treat, right? The relationship that you build with the patient is a critical component of this. And that patient really becomes a client of yours, and that relationship can endure for years. We have patients doing this program for year after year consistently. If this is what works for them, this is what they do for pain, right? If they have pain, they come to you and they're doing this program, right? And they'll do this year after year after year. So that being said, this is an amazing business model for a nurse who wants to do this as a mobile treatment program. And by the way, we're the only mobile pain treatment program in the country that we're aware of, and I look all the time. I haven't found anyone else. And it's been growing very rapidly. The more that the healthcare system wants to get away from opioids, you see this all the time. We got to get away from opioids. Okay, well then what do we do? What's the next option if you can't do opioids? Well, the more that the medications become less attractive, the more this is actually becoming attractive. We're seeing this all over the country. As soon as the local doctors find out that there's a nurse in the area, that the treatment works, it's non-pharmaceutical, they get pretty excited and they start sending people. And that's part of the business model for you as well. So let's go into the actual business model of what you can do as a nurse in the mobile pain treatment program. Okay, so you as a nurse are contracted with us. Our company is registered almost all the states. We're getting through all the states to get registered as a group practice. And so what we do is the way it works is that a patient who's interested in our treatment would have their current doctor order the treatment for them. And that doctor would simply sign the order form saying, yes, I order this for the patient for the benefit of their, chronic pain. Hand us the order form, which is going to be the 8-week treatment cycle I discussed earlier. And then we carry out the treatment. We bill Medicare and commercial insurances directly, and we pay out to the nurses when we receive all the reimbursement. Okay, so that's how it works. A patient is interested, their doctor orders it, you carry out the treatment, and then we bill and collect and then pay you your portion. Now, the benefit of the patient's doctor ordering it, because I've had people say, well, why don't we have doctors that just order it for the patient? Well, we would have to, there's lots of reasons why, but we would have to establish care with every single patient. Sometimes you can't even do that because there's, rules on who can go to see which doctor and stuff. But, we'd have to establish care with the patient. And it just gets more complicated in that model. In our current model, it's very simple. The best aspect of the current doctor for that patient ordering the treatment program is that it directly opens the door to you, the nurse. Right. So if there's a patient who wants treatment, let's call her Miss Jones, and she has her internal med doctor, who is Dr. Smith, and she says, hey, I'd like to have the treatment program, please. And the doctor signs it and hands back over. You start carrying out the treatments and reporting back in the patient's success. Well, Dr. Smith sees that and says, this patient's getting quite a bit better quite quickly. I'm very surprised. And most of the time, doctors are very surprised at how effective it is, especially for some of the conditions we know are very effective, neuropathy and fibromyalgia and other things like that. Treatment works amazingly well. Patients get out of pain very quickly, and the doctors are very impressed, right? And so suddenly they're like, well, I've got dozens of other patients just like her. Can you treat them as well? Absolutely. And the next thing you know, that doctor is sending you patients left and right. Now, imagine having 2 or 3 or 4 doctors in your area thinking that way, and then sending you patients on a regular basis. And they might do that for years, right? And that's just an amazing situation to be in, because you'll be completely filled with new patients coming in from doctors that are referring it because they were very pleasantly surprised with the results. And I'll go through kind of how the marketing works to get to that point here in a minute, but let's just go into some more of the business aspect of this. So as an independent contractor, nurses are required to purchase all of their own supplies and equipment. And I understand this could be a little bit of a burden for a lot of people out there. They're not in a situation to do this. That's fine. This may not be, it may not be possible for everyone to do this who wants to do it, and I get it. But the only way to make this work is if the nurses just own and operate their own equipment and buy their own supplies. So, and we'll get into the income afterwards, so you know that there's substantial income available for this to offset the cost. But the equipment package for this program is $30,000. We use the Neuromed PMT mobile system, and that equipment package includes the equipment, the training, the online platform for support, which is, all of that. There's probably on our side, if you add in the marketing, the training, and the online platform, that cost for our company alone is easily exceeds $5,000 worth of just expense that we have to just pay for when we bring someone on, right? So that being said, that's the $30,000 equipment package. It seems high, but at the same time, the income potential is substantial. Now, before I move on into that, there is financing. There's financing available for the equipment package. Most nurses are getting this financed down to maybe $500-$600 a month. It's very manageable. I've talked to many nurses who were able to get anywhere from 2 to 6 months of no payments. So they would get a financing offer from one of the companies we work with. We work with several really good companies that do this for nurses. But they would get a good offer from a company, and they might say, okay, we'll give you 3 months no payments as well. And so that gives you a chance to start getting your revenue flowing in. and to start making those equipment payments before you ever have to actually, make a payment out of pocket, right, for the equipment. And that's the idea. And that can happen. That really can. And the way we're doing this model in the on the Medicare side, I'll explain it's a little bit different because we can pay more quickly on the Medicare side of it. But there should be in an average area for an average nurse, there should be revenue flowing within the first month of activity. If you can get some patients across the line from the marketing, then you should be able to get some patients in treatment and then start getting reimbursement and payment in that first month. And that's what we want to see for every nurse. So that being said, that's the equipment package that comes with again the marketing and the patient flow we talked about, and the training in the online platform and all of that. Okay. So the other aspect of this, oh, and by the way, it also comes with, I should have mentioned this, comes with a $2,000 credit for IV supplies, because you're going to need IV supplies for the IV component. And we include $2,000 of credit toward IV supplies to get you going. Should be enough for 2 or 3 months of activity for treatment. So that's there as well. Okay. So revenue and income, right? So a Medicare patient, you're looking at on average around the country, the average treatment per treatment event out of that 16-week treatment event is $160 per treatment. That's what you're looking at across the country as the average with Medicare. So we pay the nurse, the nurses get paid 160. Sorry, 160 is what the nurses are getting paid for that treatment event. That's your average. So if you're thinking about this, okay, so 2 times a week and 160 per treatment on average, times 8 per month. So if you kind of block it off into months, you can do that. Let's just say, to keep the math simple, let's call it 150. It's a little bit more than that, but it's 150 times 8. That's $1,200 a month per patient, right? So 150 per event. That's again just for math purposes, 150 per event times 8, treatments, $1,200. So obviously it's a little bit more than that because you're actually getting 160 on average, but that's what you're looking at. So if you calculate a patient as being worth over, just over $1,200 a month for you, then you're thinking, okay, great. Well, then I can calculate my revenue. Now, again, we're talking about Medicare patients because that's the only payer category anyone can quote from, right? You can't quote from all the commercial insurances because they're all different. Every single one of them is different. But for Medicare, we can give estimates of what they're supposed to be reimbursing because they publish things like that. Okay, so that being said, if you had, let's say you had, 6 patients, which is part-time, right? Or close to half-time. So 6 patients getting treated 8 times a month, and the average amount being just over $1,200 per patient. So 12 times 6, you're looking at, roughly over $7,000 a month in activity, just from Medicare activity, just Medicare patients. So that's great. That's how much you're getting paid just for carrying those 6 patients on a regular basis. We believe that full time for a nurse is somewhere between 12 and 15 patients. And so if you were able to carry 12 to 15 patients consistently all year long, you could do quite well. It's very possible to make over 200,000 a year in some areas. If you add in the commercial insurances into that, some of those do pay better. In some scenarios, it's very possible to hit that $250,000 mark if you have the patient flow and you keep it, consistently going. And there's some work for you to do on that. It is your own business, by the way. You are going to be responsible for keeping the activity going. Once a patient gets treated and they're done, then what do you do after that? We're going to train you on this, but they're done. But now what? Well, now they might have 20 other people that they know who need treatment, right? You need to have that relationship with them. You need to talk to them. You need to encourage them to send you people and get those referrals, right? That's part of you growing your business in that area, is to get a broader, contact pool of people and patients in that area who are going to need treatment on a regular basis. So that being said, there are 5 avenues of patient flow. And I'll just briefly go over them. Paid marketing is number 1. We start out every nurse with paid marketing to get some patients in the door. Those patients, their current doctors are ordering treatment for them, right? So that opens the door for you to connect with those doctors, and those doctors start referring patients. So doctor referrals are the next category. Third one is patient-to-patient referrals. So you're going to have lots of that happening. Patients telling friends and family. I got better. It's amazing. It works. You got to try it. And then they're sending people your way. So you're getting lots of referrals from your current patients. And that happens all the time. Fourth one is organic search traffic. We have a lot of people looking online. We get hundreds of leads a month coming in from Google searches and places like that, and other search engines all over the country, coming in looking for pain treatment, right? And those become leads, and those funnel right through into the nurses' accounts. Their online systems that we work with, and then they see those leads pop through. You can reach out, call them, and actually get in contact with the patients to get them converted into a patient, right? So organic traffic is the fourth one. And then the fifth one, which is actually the strongest one for the nurses, is the repeat treatment, right? So you treat a patient, say you treat a patient today, they do the 8-week program, they got out of pain, it worked great, right? They're 100% out of pain, which is very common in neuropathy and other conditions. Out of pain, feeling great. It will last likely somewhere in the neighborhood of 3 to 6 months, right? Most people it's going to be more than 3 months for most people, but somewhere in that 3 to 6 month mark, the pain might start coming back, right? It's actually kind of a lot like some of the procedures, steroid injections and other procedures that have to be done, on a regular basis to maintain the outcome. But in our case, this patient now was saying, "Hey, I'm coming back into pain, but I still don't want medications. I still don't want procedures. I still don't want surgery. I still want to do this." So they'll come back and do this with you again, right? They can do another 8-week program, right? They'll do the same thing again next year, right? Every 3 to 6 months, they'll probably call you back up and say, "Hey, can I get another program, please?" Yes, absolutely. And you'd be able to get them back into treatment and treat them again. Now, one of the things that we have noticed is that the exact opposite occurs with our program as what you see with pain medications and procedures and surgeries and things like that, or procedures and steroids, is that the more frequently a patient engages in our treatment program, the more effective it becomes. It's just part of the natural beneficial aspect of what we do. We're stimulating the nerves, we're stimulating the tissues, we're hydrating and health coaching along the way too, right? So we're doing all these things to help them actually get better, not just treating the pain, but they're actually getting better in a lot of cases. So a second course of treatment, sometimes we've seen that it just is much more effective, much faster, right? If it took them potentially 4 weeks just to get mostly out of pain the first time they went through, the second time they go through, months later, it may only take a couple of weeks to get back to that point where, or maybe even a few treatments, 2 or 3 treatments gets them back to that point where they ended at the last one, and they're pretty much out of pain now, right? So their bodies do respond better on the second treatment and keep going, and it can last longer. We've had patients that have gone over a year with no pain or very little pain at all. And telling us they feel amazing. It's been a year since they completed their program. So, I mean, that's excellent. That's what you want for everyone. But not everyone gets that. Most people will get a few months at least of relief, and then they might need to do another treatment. So there you are. You're ready to treat them. But that's the fifth one, and that could be the absolute strongest one. It's very possible that a year into the treatment program, most all or nearly all the patients on your schedule are repeat patients, people doing the program again. And you have no room for new people, right? That can happen, right? So, and we'll talk about what to do if that does happen down the road. But I just wanted to kind of go through that model with you. So if you are carrying a pretty decent load of patients, 12 to 15 being roughly full-time, and let's just assume that they're all Medicare for the sake of argument and for simplicity, right? I mean, you've got excellent revenue flowing in, excellent money and excellent income coming in from those patients. And if you carry that all year long, then you can earn what we are displaying and showing in the ads and promoting. Is it's possible to earn this much if you stay with it, keep those patients engaged, keep treating people, ask for referrals, build your business, right? And we'll help you. Again, we're not just throwing you out there on your own. We'll absolutely help you. We do marketing, we have coaching. We have several people in our system who would love to connect with you and help you help you build it up. Some of the nurses come into our system ready to go and doing this. They can get a full load of patients inside of the first 4 to 6 weeks of activity. I mean, I've seen it happen. There was one nurse that came on board, and I didn't hear anything from her for a while. I knew she went to some of the trainings and things and reached out. I'm like, "Well, I haven't heard from you in a while." So, "Oh yeah, I'm busy." I haven't reached out because I'm busy. I'm practically slammed with patients. And there's another nurse that I talked to who she was kind of concerned. She was in more of a rural area. And, here it is, 4 to 6 weeks later. And I just, connected with her recently. And she's like, I'm completely filled. I actually don't know if I can even take another patient right now. I'm like, that's amazing. So that's great. That's what you want. And it'll keep on going, keeps on growing. The more patients you treat, the more they tell everyone, more doctors refer, everything keeps growing. Right. And so this is a long-term operation. This is not just to try this for 6 months and then just, walk away. You're going to develop relationships. These people will be with you for 10, 15, 20 years potentially, right? They're going to stay with you. This treatment works and this is good for them, right? They want this. Okay, so that being said, the onboarding process, assuming that you want to do this, right? Let's do this. And assuming that you can actually, manage this $30,000, equipment package that we need for you to actually get going. And I know that's not everybody can do it. Talk to me anyway. There are options, and sometimes we have equipment we can get at a discount. It just depends on the situation. We don't always have stuff like that available, but we have. I've had several nurses that have been able to get started with us for less because we had another nurse who couldn't do the program anymore and wanted to put their equipment to use, and that can happen too. So just reach out to me. Let's still talk. We can figure it out. But assuming that you want to move forward, we get the equipment package ordered. It's about a 2-week onboarding process to get you onboarded. So you're going to get the equipment. You're going to get supplies shipped. We get the marketing. It's going to get turned on. You're going to get training scheduled. There's multiple trainings, different things to schedule. Training is a Zoom training for the equipment. It's a 1 or 2 hour Zoom training on Zoom with our training nurse. And then for marketing training, it's typically going to be 1 hour segments of marketing training. We have dedicated marketing experts in our company who can talk to you about how to talk to patients, how to manage your online account, all that stuff. It's all covered as far as how to do it. We've got people that can help you. And then at that point, you're treating patients. Treating patients. We do notes and charting via a simple online system. You can actually do it on your phone. You can do that while you're with the patient. It takes you maybe 2 or 3 minutes to fill out the notes and charting and send that in. Super easy stuff. It's so much easier than what a lot of other nurses are experiencing. And I have talked to thousands of nurses now. No joke, thousands of nurses. I've heard the stories, and I've talked to so many who are thinking, I gotta get away from this hospital system. I gotta get away from bedside nursing. I am so tired of working night shifts, right? I hear this all the time. And then when you get into something like this, that can actually, replace all of that income, make better than normal income, actually have some, I would say some freedom. If you've ever actually, done your own business like this, it's a different kind of freedom. It's still work. It's still work. You still have obligations. You're still treating patients that need you. That is still there. But the freedom is that you're doing this because you want to. That patient is someone that you want to treat. It's someone that you have chosen, right? We don't make you treat anyone. If there's a lead that comes in or a patient that you don't want to treat them or can't get out to their house or whatever, you don't have to treat them. You can say no to people if you don't want to actually take them on as a patient. Absolutely. You're in control of your schedule. So that makes it so that the people you are treating, that's your choice, right? You're choosing to treat them. They become your client, like I mentioned earlier. And there is freedom in that. There is work involved, but it's a different kind of work, and it's more freedom, more of a freedom on your side that you feel like I am doing this because I want to. And again, the money is better than normal as well, and that makes a big difference, right? When you know that the work you're doing is one, it's really helping this patient. It really is. And a lot of these patients, this is the only thing that works to get them out of pain. And when you see them get out of pain, it will absolutely change your life. I'm not exaggerating that. I've talked to dozens of people, doctors, nurses, staff, who have been completely blown away at how watching these patients get out of pain has changed their life. That is the exciting part. And it really is. It's so fulfilling. I mean, it's the exact opposite of what so many people are dealing with in their current job. This is fulfilling. People get their life back, right? I can't say anything more about that. And then on top of that, you're getting paid better than normal to do it. So it's all a win. It's not just a win-win. It's a win-win, win-win-win, right? So there's a lot of wins here, right? So reach out to me, connect with me. Let's do a quick chat. I have Zoom and calendar systems. You can book a Zoom time with me. I'd love to talk to you and see if we can get you going in your area and in your state. Thank you so much for watching, and have a wonderful day.